Hi, my name is Dr. Joanny Garcia, and I'm the Director of the Division of General Internal Medicine and a practicing physician here at RWJBarnabas Health. Today, I want to talk to you about the Pfizer BioNTech and Moderna COVID-19 vaccines. The U.S. Food and Drug Administration, or FDA, has granted emergency use authorization for these two vaccines. Both of these vaccines are not approved by the FDA. In separate clinical trials, the Pfizer BioNTech and Moderna vaccines were each found to be more than 94% effective for preventing COVID-19 infection after the second dose. The Pfizer BioNTech vaccine is authorized for individuals aged 12 and older. The Moderna vaccine is authorized for individuals aged 18 and older. You have the choice to accept or refuse both of these vaccines. We would like you to know some facts about these two vaccines. Both of these vaccines require 2 doses. The second dose of the Pfizer BioNTech vaccine should be administered 21 days after the first dose. And the second dose of the Moderna vaccine should be administered 28 days after the first dose to be fully effective. Please keep this in mind when scheduling your appointment for your first dose, and be sure to keep track of the date and time for your scheduled second dose. It is important that both doses you receive are of the same vaccine. That means if you received as the first dose the Pfizer BioNTech vaccine, then the second dose must also be of the Pfizer BioNTech vaccine. Please note that you should not receive either of these COVID-19 vaccines if you are allergic to any of the COVID-19 vaccine ingredients. The ingredients are listed on the fact sheet for recipient and caregivers that were made available to you for each of these COVID-19 vaccines. You should not receive any other vaccine, for example, the flu vaccine, within 14 days before receiving a dose of these COVID-19 vaccines. If you have received another vaccine in the prior 14 days, please do not schedule the COVID-19 vaccine at this time. You may schedule the COVID-19 vaccine once at least 14 days have passed between vaccines. It is also recommended that you wait at least 14 days after the second COVID-19 vaccine dose before getting any other vaccines. If you have had a severe allergic reaction to any other vaccine or injectable therapy, please consult with your doctor before scheduling this vaccine. If you are pregnant or breastfeeding, please consult with your doctor before scheduling this vaccine. If you are immunocompromised or take immunosuppressant therapy, the vaccine may offer less protection. There are risks and benefits to receiving this vaccine that you should be aware of. There's a remote chance that the COVID-19 vaccine could cause a severe and/or immediate allergic reaction. That is why you will be observed for at least 15 minutes after you receive your COVID-19 vaccine. Side effects shown in clinical trials included pain at the injection site, tiredness, headache, muscle pain, chills, joint pain, fever, injection site swelling, injection site redness, nausea, swollen lymph nodes, and generally feeling unwell. If you experience any of the following symptoms within 4 hours after receiving the first dose of the vaccine, you will need to be evaluated and cleared by a physician, and you may want to speak with an allergist immunologist before you receive your second dose of the COVID-19 vaccine. These symptoms included feeling of impending doom, anaphylaxis, pruritus or itching, urticaria, hives, flushing, angioedema, confusion, disorientation, dizziness, lightheadedness, weakness, loss of consciousness, shortness of breath, wheezing, bronchospasm, stridor, high-pitched wheezing, hypoxia, hypotension, low blood pressure, tachycardia, fast heart rate, vomiting, abdominal cramps, and/or diarrhea. Please note that if you have any side effects that bother you or do not go away, you should contact your primary care physician or seek other medical advice. If you experience a severe allergic reaction, you should call 911. Please note that all side effects should be reported to the Vaccine Adverse Event Reporting System, or VAERS. This national system collects data to look for adverse events that are unexpected, appear to happen more often than expected, or have unusual patterns of occurrence. We will provide information about VAERS when you get your vaccine. It is unknown at this time for how long the vaccine may protect you from getting COVID-19. We will learn more about the risks and benefits of this vaccine with time. Currently, there is no FDA-approved alternative vaccine to prevent COVID-19. There are other vaccines still in development. Their risks and benefits are also not yet fully known. Finally, please remember, even after getting the vaccine, you must continue to practice CDC recommendations, including physical distancing, good hand hygiene, and wearing a mask in order to prevent transmitting COVID-19 to others.